Dr. Parit Ladani, a highly experienced oral and maxillofacial surgeon, recently led a comprehensive 3-day ear reconstruction workshop aimed at training fellow maxillofacial surgeons in the intricacies of this specialized surgery.
On one surface, right? So it should not be on the carving surface.
The workshop featured live demonstrations of both Stage 1 and Stage 2 ear reconstruction procedures, offering participants a rare opportunity to observe and learn firsthand from Dr. Ladani's expertise. In addition to the live surgeries, the workshop included in-depth discussions, lectures, and practical ear carving exercises using carrots, providing a well-rounded approach to mastering ear reconstruction techniques. Designed to fully equip attendees with the necessary skills and knowledge, the workshop attracted surgeons from across the country, including Bangalore, Kolkata, and Vadodara, who left with valuable insights and confidence to perform these complex surgeries independently. So let's hear their experience about attending this workshop.
My name is Dr. Kalhan Nambardar, and I am a maxillofacial surgeon practicing in Vadodara. I am into cleft lip and palate surgeries for the last 9 years. I'm attending a ear reconstruction workshop under Dr. Parit Ladani at Mumbai. For the last 3 days, it has been a wonderful experience of coming here. This is one of the most comprehensive workshops that one can attend, which serves an eye-opener, a beginning towards this particular field of aesthetic facial reconstruction. I think it covers almost the entire spectrum of whatever is needed to understand the concepts of reconstruction of an ear. It's a perfect balance between theory, practical, hands-on, and a lot of fun as well. I would recommend anyone who's interested in learning ear reconstruction. I think this is perhaps the best place to begin.
Hi, I'm Dr. Prajwal. I'm a consultant maxillofacial surgeon from Bangalore. So I attended this 3 days ear reconstruction workshop from Parit Ladani sir. So it was a very well structured 3 days workshop, including hands-on as well as a training live surgery workshop for 3 days. So first day we had an opportunity to attend his live surgery, both stage 1 as well as stage 2, and it was well explained during the surgery. And the second day we had an opportunity to listen to the lectures from Dr. Parit Ladani sir. He explained each stages, and he also cleared all of doubts. And after that we had an opportunity to carve the ear using the carrot, and it was again well guided by his team and sir. So third day again we had an opportunity to attend the live surgeries, both stage 1 and stage 2. So I thank Dr. Parit Ladani sir and his team, including Dr. Jugal, Dr. Shraddha, as well as Mr. Rahul, for arranging this wonderful workshop. It was very helpful for us since we know ear reconstruction surgery is a very challenging surgery. They trained us so well. Now we are going with carrying a lot of knowledge from Dr. Parit sir, and I thank once again for all of his team members for conducting this workshop. Thank you.
Hi, I'm Dr. Varun Ramchandra. I'm a cleft lip and palate surgeon from Vadodara. I'm learning ear reconstruction under Dr. Parit Ladani. Sir has been very kind, very helpful. He has taken us stepwise through the surgery. He's taught us each and every aspect of it, and it has been an enlightening experience. I would definitely recommend my fellow colleagues, juniors, to come learn this beautiful art of ear reconstruction. Thank you.
Hello, I'm Dr. Rajarshi Basu. I'm an oral and maxillofacial surgeon practicing in Kolkata. I was here in Bombay at the Holy Spirit Hospital to undergo an ear reconstruction workshop under Dr. Parit Ladani sir. It has been a wonderful experience, and sir took us step by step through all the procedures, and there was a lot of theory and a lot of practical, and a good part of hands-on was there in this course, and we learned a lot from workshop, and I would recommend anyone who is interested in learning the art of ear reconstruction to attend this workshop. It will be greatly helpful. Thank you.